Thank you, David, for inviting me, and thank you for the wonderful introduction. I unfortunately was in the state hospital in Pontiac, Michigan, when I was 16, and I'd had problems for 3 years, starting when my mother underwent her first operation for intestinal cancer. And I developed stomach pains, and I felt I had possibly had cancer too. And the doctor couldn't find anything physically wrong. And things got progressively worse. And pretty soon I had very little energy, and every day was a chore, a very heavy chore. And then finally, I became so upset about my stomach and my feeling that I wasn't receiving any help. I probably, by today's standards, I should have been referred to a psychologist or a psychiatrist for evaluation at least, but that didn't happen. And finally, things were so bad. When I tried to go back to school, I was told that I couldn't come back until I had help. And then I guess the assistant principal, the one I dealt with there, called my mother, and then she was a teacher too for many years, and she became upset. And then my first appointment with a psychiatrist was soon after that, and he said I was too sick to be treated in the community, and he sent me to this hospital in Detroit, uh, which had an adult program. I was there for about 2 months, and there was really nothing for me to do. I just paced the halls. They had quite a long hall there, and they gave me Thorazine, which kept me on the verge of falling to sleep all the time. And I had brief conversations with the adult psychiatrist there in the morning. And then finally, I put my foot down. I said, I can't stand it here. He sent me to live with a relative. And all this time I was there, I did not see my mother. And of course, my father was always very aloof, and he had very little to do with me, except for being angry at me for everything. And then after that, I was seeing him as an outpatient. He told me I was still too sick, and he sent me to the state hospital, which came as a big shock because I was hoping that I could go home. You know, being only 16, you want to stay close to your family and your mother and father. So I was sent to the state hospital, and this hospital was built in the 19th century. It opened in 1878, and it was the building. Well, actually, the building I was in was built at the time of World War One, and this was 50 years later, or almost 50 years later, in 1960. And the
Michael,
heat.
what year was it you went to the state hospital?
Michael, what year was it you went to the state hospital?
January 1960. I was 16, and this building, most of the state hospital was built in the 19th century, and this was the newer part, which was built around 1917 at the time of World War One. And this was in January, and it was, of course, in Michigan, it's very cold in January, and there was no heat in the bedrooms that I could tell, and then they smelled awfully bad. And during the day, we sat in a circle in the what they call the day room there, and there was windows on three sides which leaked very badly. And again, they gave me a very heavy dose of Thorazine, which I didn't like.
I'm also a survivor of Thorazine.
I'm also a survivor of Thorazine.
I'm sorry, I didn't hear you.
Oh, he said I'm also a survivor of Thorazine.
Yes, yes, I was. And then at that time, they did have other tranquilizers which were less sedating. And there was stelazine and trilofan, but they chose Thorazine for me, which was, I would say that was very inappropriate since I was very depressed. And Thorazine, of course, will make you more depressed. And I thought constantly of suicide, and I had made one attempt that I know of by cutting my arm near my vein. So then they started shock treatment, which I didn't like at all. And I asked them about it, and they said I absolutely had to take it. And I could see that they frequently use physical force on, excuse me, on patients there. And I was on the third floor, and they took me up to the fourth floor. And I had a shot, I think, of scopolamine to stop my secretions so I wouldn't throw up during the shock treatment or gag. And we had to wait in this bedroom there, which was unheated. And they called us out in the hall one by one. And they had me lie down on a stretcher in the middle of the hall. And the doctor there injected me with something in the vein in my right arm. And a few seconds later, I couldn't breathe, which was a horrifying experience. I thought I was dying. I couldn't imagine a doctor doing anything like that, but he did. And I had,
Michael, may I ask you a question?
Michael, could I ask you a question?
Sure.
Did your mom or dad ever consult or sign or agree to the shocks?
Did your mom or dad or an adult agree to sign up to the shocks?
I'm not sure. I was committed there by the court. So I was an involuntary patient. I don't think she had to. I don't know.
Also, everybody,
Also, everybody,
if you click in your upper right corner,
if you click on your upper right
under
corner,
view, you can do speaker view,
if you click on the upper right on view, you can click speaker view.
and that way you'll see Michael on the whole screen.
And that way you'll see Michael on the whole screen.
Like we can go back to gallery
And then we can go back to gallery
later on.
later on.
But go ahead, Michael. Yeah, how many forced shocks did you have?
Go on, Michael, how many forced shocks did you have?
One of my therapists later on obtained my record, and he told me I had between 20. They didn't keep very detailed notes there. They would never do for today. And they said I had between 20 and 30 bilateral shocks.
God.
And bilateral is the kind that is most damaging. And then every time that I had the shock treatment, I had the same thing happen where they injected me and I couldn't breathe. And later I learned that what happened was, what probably happened was that they injected me with the muscle relaxant, which stops breathing along with the movement of all the muscles, and that's to prevent a bone breakage from the convulsion induced by the electricity. So what they're supposed to do is give you a sedative first, which will put you to sleep, and then you can't experience the muscle relaxant cutting off your breathing. And this happened. I complained about it, and they of course they did nothing. And so later on, I was reading up on this, and I encountered a book by Peter Bregan, who's a very famous psychiatrist in this country, and the title of the book is Electroshock and Brain Disabling Treatments, I think. And he said in there that this practice was never was done by a number of psychiatrists. It wasn't acceptable to most, however, but it happened, and I have to live with the consequences. And every day I think about it, and it induced a post-traumatic shock condition, post-traumatic stress condition, excuse me, I think. And then as soon as I was done with the shock, it was such a terrifying experience. It's something like you might think the Chinese or the North Koreans would use, or the CIA at its worst might use on someone to get information. And so I was terrified that this could happen again to me after I was done with my series of shocks. And I continued to be terrified even after I went home. I was there for 10 months. And after I went home, I went back to school, and it was hard to concentrate on anything else except the state hospital and shock treatments, and anything I did that my family didn't like, they would threaten to send me back there. And I was pretty outspoken and loud mouth. If their goal was, with the state hospital's goal was to shut me up and to keep me quiet for good, they certainly did the opposite of what they intended, because I spoke to everybody about it I could, and including my counselor at school, and he would spend extra time with me. I was so upset. I just needed to talk to someone. You know how it is. And then my mother died while I was in the hospital. She actually did have intestinal cancer, and she died shortly before I came home. And so I had that to live with too at the time. And it went on for years. It was just the total fear of the whole thing. And I had to go back for a year for checkups every month or two. And I was just terrified every time I went back there. And just to talk to them, just to see the place. And I just recently looked it up in Wikipedia, and said it's built in a Gothic style. And that's what it was like there. And then after the shock treatment, they moved me out to a old house on the grounds, which didn't have a fire extinguisher. The house was built around the same time as the hospital, maybe around, I think it was 1900. It was a frame house, and there was no place to sit. You could just lie in bed. And I had a grounds card where I could go out and walk around the grounds. And then uh, I had therapy with a social worker there, and we reached the point where we couldn't agree anymore because I wanted to get out of there. I felt so threatened by the whole thing, and I had a severe memory problem after the shock treatments, and especially problems with losing what I had learned before in school. When I went back, it was hard to spell words, or I had to write something. I was in the 11th grade, so I was expected to write term papers and so on. And I couldn't spell words, and I was agrammatical. And then when I tried to talk, I couldn't find simple words to say what I wanted to say. And if I said something, I might say what rhymed with what I wanted to say. And then later on, when I was a psychologist, I found out these were symptoms of aphasia. And
Michael, can I ask you something?
Oh, Michael, could I ask you something?
I mean, there you were a student
There you were a student
with horrible effects.
with horrible effects.
How did you become a psychologist?
How did you become a psychologist?
well, I thought this was so horrible,
It takes a lot of training.
and I wanted to change it. And I thought I could do a lot better. You talk to any of the doctors there, and I mean, it's just caustic. It's like having acid thrown in your face. I mean, they're so rude to you in every way. And if I tried to tell them about problems I was having there, asked to go home, it was never any sort of positive response. And finally, what happened, I went to summer school there, the high school in Pontiac. It's only about a mile away, so I could walk over there. And I completed both courses. I took 2 courses. I completed both successfully with good grades. And I thought I could be released, that I'd shown that I could function in the community, and I could carry out everything, except I did have trouble with writing. I had to use help from, I had to have help from some members of the staff there at the state hospital with my compositions, but otherwise I did very well. So I thought I'll ask to go home, and I asked to go home, and they said no. And then they complained about my not making my bed on the mornings I went to school because I was in such a rush, and not taking care, not participating in the cleanups and so on. And they told me I couldn't stay there in the house on the ground. In fact, what they did is they put some slivers underneath my nails. It was a horrible experience, and just to teach me just to do everything they say there. I think that was their purpose. They just want you to, they don't want you to think, they don't want you to criticize them in any way. Just do everything we say. If not, we will hit you as hard as possible. So what they did is they sent me from this open house on the grounds to a back ward. And a back ward is where they keep the very worst patients, people who just rock and talk to themselves and so on. And I had to sit in this little room. There were other patients there, and they would smoke these roll-up cigarettes. And these are just awful smelling things, worse than cigarettes that most people smoke. And I would cough all day, and then you had to sit there and do nothing. And are you all right, David? Oh,
My
okay.
bed is an air bed,
The bed is an air bed that makes noise, so we
so
muted.
makes a
So
little noise.
Okay, okay.
Yeah,
So anyhow,
Michael, I'm curious about when you became a psychologist here in Lake County.
So Michael, I'm curious on when you became a psychologist here in Lane County.
What it was like, you know, you're retired now,
What was it like? I know you're retired now.
but what insights do you have about Lane County mental health?
What insights do you have about Lane County mental health?
about Lane County, well, I was in a labor dispute with them, and part of the settlement was that I not say anything about them or talk about it beyond that. But for the most part, they seem to be doing well.
So let's open it up and see if anybody has questions for Michael.
So let's open it up and see if anybody has questions for Michael.
You can say something
You can say something
or put something in chat.
or put something in chat.
Does anybody have a question?
Does anybody have a question?
Well, I will take advantage of your being here. My name is John Marshall, and I can certainly relate. I grew up in Michigan outside of Detroit, and I had friends who went to some of the institutions, I think maybe Pontiac. At any rate, with all of the history that you have experienced, is there any way you can put where we currently are in some sort of historical perspective? Let's say, are we getting better? Is it up and down? Is there a status quo? In 20 years, things will be better than they are now? I don't know. Does my question make any sense?
Yeah, I see what you're talking about. These state hospitals were so bad. Pontiac was closed in 1997 and demolished in 2000. And this was the result of the movement to take people out of the state hospital and put them in other facilities. And what happened was that a great number of people ended up on the street. That didn't work out very well. And they were supposed to go to community mental health, but they were not well funded, and that was not sufficient. What they needed was a stable residential facility, and many of them were disabled and on SSI and SSD. It worked out for me because I went home, and my mother had died. My father was opposed to mental health. So he would not allow me to take medication, and he would not allow me to have therapy. And eventually I was able to finagle my way into seeing a psychiatrist, but that took 2 years. Anyhow, for most of these people, there isn't much of a follow-up. If they don't fit in at mental health, and many of them don't like these medications, they have side effects, and they're extremely sedating and can't do anything else. It's like jumping from the frying pan to the fire for most of them. And now they're coming up with these stabilization centers, which have not been actualized yet. And I wonder if 10 days or whatever they allot in these stabilization centers would be enough, and that we still have the same old problem of mistreating the mentally ill and neglecting the mentally ill. And I expect that to continue for the foreseeable future, except in those cases of the less severe cases, less severe illnesses, such as myself, that can find help on the outside through the private sector.
I'm curious about what John says.
Oh, Michael, I'm curious about what John says.
Do you think things are getting better now or worse?
Do you think things are getting better now or worse?
I think overall they're pretty much the same. Some ways it's better. There's more psychologists, more people available in the private sector if you need to find someone. There are now psychiatric wards specializing in children and adolescents, which there weren't at that time. and also the diagnosis has become more sophisticated. But a lot of people say it's still like a cookie cutter where you're given a name and then everybody thinks you have all the characteristics of these diagnoses, such as all schizophrenics are supposed to be dangerous because a few of them are, and that all people who are in state hospitals are schizophrenic. We know now that's no longer true. But as far as the treatment end is concerned, it's still very lacking for most.
Michael, I'd say one big improvement is there are more peers nationally.
So Michael, I'd say one improvement is that there are more peers nationally.
There are
Yes.
30,000 certified peers now.
There are 30,000, 35 peers now.
30,000
30,000
certified peers.
peers.
So actually, you're a peer with lived experience.
So actually, you're a peer with lived experience
Mental
of mental health
issues.
issues.
That played a role, you being a peer.
Has that played a role, your being a peer?
Did you disclose that to clients?
Did you disclose that to clients?
No, I never did. Frankly, I was afraid of what my supervisors would do to me if I did, if they found out. So I kept it a secret as best I could. And my therapist told me that if I share my experience with other people, it wouldn't necessarily help them because everybody's experience is different. And I had some things to work with, such as I could go to school and I graduated 3 times, and other people could not do that. And then my father, despite his attitude towards mental health, was a well-to-do man, and he could afford many things. And he bought a car for me when I was in college. I went to a university in Detroit, and I had to drive down there every day. And if I didn't, for a while I took the bus, which was very hard because I had to make multiple connections in very bad neighborhoods. So that really helped, and we had plenty to eat, and I had terrible teeth when I got out of there. I was seeing the dentist once a week for, I think, 6 months before I had my teeth repaired.
Oh
So
my God, I'm really glad it's no longer a secret.
Well, Michael, I'm really glad it's no longer a secret.
We need to help get your story out there.
We need to help get your story out there.
I hope you'll consider like writing something for people
I hope you'll consider writing something for people
here in Lane County
here in Lane County
because your story has to get out.
because your story has to get out.
Like in Eugene Weekly.
Like in Eugene Weekly?
Are there any other questions from folks?
Are there any other questions from folks for Michael?
Yeah, Michael, who are your some of your top 3 or 4 writers on the intersection of psychology and lived experience? Any come to mind?
other people who've come out like me well, I've published 3 articles in Mad in America, including one with my state hospital experiences. And I've had close to 5,000 hits on that. So I don't know who these people are, of course.
So now I'll have Deborah turn off the recording.
So now I'll have Deborah turn off the recording.
And